This short video is about meeting and greeting people. In a healthcare setting, this is the initiation of the consultation. Welcome to Consultations for Health, helping you progress your communication skills to help optimise the care of your patients. At some point in our lives, we all have to introduce ourselves to new people. When we do, we are trying to make a good first impression. Let's watch a few examples of people meeting for the first time and identify those things that will help make that good first impression.
Here is an example of two people meeting that doesn't go so well. As you watch the clip, have a think about why this may be.
Hi, I'm Frances from the admin team. I've come to meet you and to show you your office.
Hi.
And you are?
Jeremy.
Okay, nice to meet you.
Okay.
Did you find us okay?
Yeah, I came on the bus.
Okay,
Yeah, so
good.
it's good.
Okay.
Yeah.
All right, then well, I'll show you where your office is and introduce you around.
Yeah, thank you.
Okay.
Yeah.
So why was it that this introduction didn't go so well? Firstly, Jeremy did not introduce his name or who he is, and instead had to be asked by Frances. As well as this, Jeremy sometimes had poor eye contact and would look at the ground whilst Frances was speaking. Most notably, Jeremy appeared rather quiet and awkward and didn't show much enthusiasm or friendliness whilst he was introducing himself. Finally, Jeremy didn't shake Frances's hand, which isn't always appropriate, but would have been polite to do in this work environment. In this example, you will see that the introduction is much better. Try to identify why this is.
Hi, I'm Frances.
Oh, hello, Frances. My name's Jeremy.
Oh, hi, nice to
I'm
meet
starting
you.
working here today.
Okay.
What's your role here?
I'm the administrator.
Oh, great. So I think they told me to come and find
Yeah,
you. Are you going to show me around and
I
show me
can,
what's what?
yeah. I'll show you where your office is and the loos and the coffee room and,
Oh,
you know,
yeah,
all the important
yeah.
things.
Lovely. Yeah, coffee
Okay.
especially. Brilliant.
Good. All right, great.
Thanks a lot. Thank
no
you.
worries.
What made this introduction better than the first one? Straight away, Jeremy said hello, introduced his name and who he was, so Frances didn't need to guess or ask more questions. In this introduction, Jeremy maintained eye contact the whole time. Jeremy also appeared much more friendly and enthusiastic. Towards the end of the meeting, Jeremy also uses humour to build rapport. Finally, this time, Jeremy did shake Frances's hand.
In a healthcare setting, starting the consultation is really important. This is the part that's going to set the tone for the rest of the consultation and help build that essential rapport that you need to have with your patients. Firstly, we need to greet our patients and confirm exactly what they would like to be called. It is then vitally important that you introduce yourselves. Patients may have seen many healthcare professionals on that day, and it is very impersonal and can be overwhelming if you don't introduce yourself and state who you are. So please, every time you start, introduce yourself and make your role clear. This has been highlighted by the legacy of Kate Granger in the NHS campaign, Hello, My Name Is. Please don't forget to introduce yourself when you start any healthcare consultation.
Now we are going to see an example of what a meeting and greeting would look like in a healthcare situation.
Come in. Hello there, grab a
Hi.
seat. Hi, Mr. Lockwood?
Yes, that's right.
And Colin Lockwood?
Yeah.
Is it okay if I call you Colin?
Yeah, fine.
Okay, can I just confirm your address then?
Yeah,
Colin?
it's 58 High Street.
Brilliant, I've got the right patients.
Yeah.
Let's start. So my name's James, I'm the pharmacist here, and I believe you've got a prescription for erythromycin?
Yes.
Once you've done those initial meeting and greeting activities, you can then move on to agreeing with your patient what you're going to talk about and what actions need to be taken. From this video, we hope you've picked up some important hints and tips on meeting and greeting people, not only in everyday life, but importantly in a healthcare setting. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter like our Facebook page and subscribe to these videos.